I bet you didn't know every breath could be a struggle. Simple tasks leave you gasping for air. This is the reality for millions with chronic obstructive pulmonary disease, or COPD. COPD is a progressive lung disease that makes it hard to breathe. It's a leading cause of death worldwide, often undiagnosed. COPD develops slowly over many years. Early diagnosis and treatment are crucial. Welcome to MD Talk. Understanding COPD empowers us to take control of our lung health. COPD is an umbrella term for several respiratory conditions. The most common are emphysema and chronic bronchitis. Emphysema damages the tiny air sacs in the lungs. Imagine these air sacs like tiny balloons. In emphysema, these balloons lose their elasticity. Chronic bronchitis causes inflammation and narrowing of the bronchial tubes. This leads to increased mucus, coughing, and shortness of breath. Understanding COPD is paramount. Knowledge is power. Recognizing early signs and seeking timely medical attention and adhering to treatment plans, individuals can live fuller lives. Early diagnosis allows for interventions that improve quality of life. To understand COPD, we must unravel its origins. What causes this lung disease? COPD is caused by multiple factors. Some, like smoking, are preventable. Others, like genetics, are not. Understanding these elements helps in prevention and management. In the vast majority of COPD cases, the culprit is clear smoking. Cigarette smoke, a noxious cocktail of over 7,000 chemicals, wreaks havoc on the delicate tissues of the lungs. With each inhale, these toxins irritate and inflame the airways, setting the stage for chronic bronchitis. Over time, this inflammation becomes chronic, leading to narrowing of the airways and increased mucus production, making it difficult to breathe. But the damage doesn't stop there. Smoking also damages the air sacs, the tiny balloon-like structures responsible for oxygen exchange. While smoking is the primary risk factor for COPD, it's not the only one. Other environmental factors, such as exposure to secondhand smoke, air pollution, and occupational dusts and chemicals, can also contribute to the development of this debilitating lung disease. Imagine a construction worker inhaling dust particles day after day, or a factory worker exposed to harmful fumes. These environmental insults, though often invisible, can have a profound impact on lung health over time. In addition to environmental factors, genetics also play a role. COPD often whispers its presence with subtle symptoms that can easily be dismissed or attributed to other causes. This insidious onset is part of what makes COPD so dangerous. Early detection is crucial, as timely intervention can slow the progression of the disease and improve quality of life. But how do you recognize the whispers of COPD amidst the cacophony of everyday life? What are the telltale signs that should prompt you to seek medical attention? Understanding the early symptoms of COPD is the first step in taking control of your lung health. Shortness of breath or dyspnea is the hallmark symptom of COPD. It feels like not being able to get enough air, akin to drowning on dry land. Initially, it may be subtle, noticeable during strenuous activities. As COPD progresses, it becomes more pronounced, even at rest. While shortness of breath is the most common symptom of COPD, it is not the only one. COPD affects the entire body, not just the lungs. Chronic cough and mucus production are also common. This cough can be persistent and disruptive. As COPD progresses, a vicious cycle often develops. Shortness of breath limits physical activity, leading to muscle weakness and deconditioning. This deconditioning further exacerbates shortness of breath, making even simple tasks seem impossible. Fear of breathlessness can lead to anxiety and social isolation, as individuals avoid situations that might trigger their symptoms. This isolation and inactivity further contribute to a decline in overall health and well-being. It's a downward spiral that highlights the importance of early diagnosis and proactive management. Unmasking the silent threat. The importance of early diagnosis. COPD is often diagnosed late, after significant lung damage. Symptoms develop gradually and are often dismissed. Early diagnosis is crucial. It allows for timely interventions to slow disease progression. Reclaim control and live fully, even with COPD. Pulmonary function tests, breathing life into diagnosis. PFTs are the gold standard for diagnosing COPD and assessing lung function. These tests measure how well your lungs are working. Imagine breathing into a tube connected to a spirometer. This simple act allows healthcare professionals to measure your lung function. PFTs can detect COPD early, making them crucial for diagnosis. Beyond the breath, a multifaceted diagnostic approach. While PFTs are essential in diagnosing COPD, they are not the only tool. A comprehensive diagnosis involves considering your medical history, lifestyle, and other tests. Your doctor will listen to your lungs for abnormal sounds. Imaging tests like X-rays and CT scans visualize your lungs. These images reveal any signs of damage or abnormalities. Empowering patients through knowledge. Understanding your diagnosis. Receiving a COPD diagnosis can be overwhelming, but knowledge is power. Understanding your diagnosis is the first step in taking control of your health. Your doctor will explain the stage of your COPD from mild to very severe. They will discuss treatment options, including medications and lifestyle changes. Don't hesitate to ask questions and participate in your care. Remember, you are not alone in this journey. Navigating the treatment landscape, a breath of hope. While COPD is a chronic progressive disease, there is hope. Effective treatment options can help manage symptoms, slow disease progression, and improve quality of life. It's about reclaiming your breath, reclaiming your life. Treatment for COPD is not one size fits all. It's a personalized journey, tailored to each individual's needs and disease severity. Your doctor will work closely with you, considering your medical history, lifestyle, and preferences to develop a comprehensive treatment plan. This plan may include a combination of medications, pulmonary rehabilitation, oxygen therapy, and lifestyle modifications. Rescue inhalers, your lifeline in need. Imagine a sudden tightening in your chest, a desperate gasp for air. This is the reality of a COPD exacerbation. Rescue inhalers are your lifeline. They deliver a quick burst of medication that rapidly relaxes your airways, allowing you to breathe easier. Section 3. Maintenance inhalers, the long game of breath control. While rescue inhalers provide on-demand relief, maintenance inhalers focus on the long game of breath control. These inhalers, typically used once or twice daily, contain medications that reduce inflammation and prevent exacerbations. Think of them as the foundation of your COPD treatment plan, working behind the scenes to keep your airways open and reduce the frequency and severity of flare-ups. Consistency is key with maintenance inhalers. Using them as prescribed, even when you feel well, is essential for managing your COPD effectively. Section 4. Beyond inhalers, a holistic approach to COPD treatment. Inhalers are often the cornerstone of COPD treatment, but a holistic approach encompasses much more. Pulmonary rehabilitation, a personalized program of exercise, education, and support, can significantly improve your ability to breathe and function. Oxygen therapy can also be beneficial, improving exercise capacity and quality of life. And let's not forget the power of lifestyle modifications. Quitting smoking, eating a healthy diet, and staying active can have a profound impact on COPD management. Section 1. The unpredictable storm, understanding COPD exacerbations. Imagine a sudden squall on a calm sea disrupting the tranquility. This is akin to a COPD exacerbation, a sudden worsening of symptoms that can be frightening and disruptive. These exacerbations, also known as flare-ups, are characterized by increased shortness of breath, coughing, wheezing, and mucus production. They can range in severity from mild to life-threatening, requiring hospitalization in some cases. Understanding COPD exacerbations, including their triggers and warning signs, is crucial for effective management and prevention. Section 2. Weathering the storm, managing COPD exacerbations. When a COPD exacerbation strikes, prompt action is essential. Your doctor will develop an action plan tailored to your specific needs. outlining steps to take at the first sign of a flare-up. This plan may include increasing the dosage of your rescue inhaler, starting a course of oral corticosteroids, or using supplemental oxygen. In severe cases, hospitalization may be necessary to receive intravenous medications, respiratory support, or other life-saving interventions. Remember, early intervention is key to minimizing the severity and duration of exacerbations. Section 3. Beyond the Horizon, Advanced Treatment Options. For individuals with severe COPD who continue to experience debilitating symptoms despite optimal medical management, advanced treatment options may be considered. These options, while not a cure, offer a glimmer of hope for improved lung function and quality of life. Lung volume reduction surgery, or LVRS, for example, involves removing damaged lung tissue to improve the function of the remaining healthy tissue. Lung transplantation, while a major procedure with its own risks and benefits, can be a life-changing option for carefully selected patients. Section 4. Living a full life with COPD. Embracing hope and resilience. Living with COPD doesn't mean living a life defined by limitations. Embrace proactive management, self-care, and support from healthcare professionals. Remember, you are not alone in this journey. Resources are available to support you every step of the way. With knowledge and empowerment, you can navigate COPD and emerge stronger and more resilient. Knowledge is power. Understanding COPD empowers us to take control of our lung health. We've explored its causes, impact, and the importance of early detection. Pulmonary function tests and a multifaceted approach to diagnosis are crucial. Treatment options range from rescue inhalers to long-term management. Preparedness for COPD exacerbations is vital. Early detection is crucial. Early diagnosis serves as our most formidable barrier against an unyielding tide. Recognize early signs, shortness of breath, persistent cough, and seek timely medical attention. COPD frequently manifests subtly. Be attentive to your body's cues. Don't ignore shortness of breath or a persistent cough. Early detection empowers action. While COPD is a chronic progressive disease, it is not a death sentence. With the right knowledge, tools, and support, individuals with COPD can live full lives. Pulmonary rehabilitation strengthens lungs and improves exercise capacity. Advancements in treatment offer hope for better lung function and quality of life. Celebrate the resilience and determination to live fully despite COPD. Remember, you are not alone in this journey. There are resources, support groups, and dedicated healthcare professionals to guide you. As we conclude our exploration of COPD, let us breathe deeply, filling our lungs with not just air, but with hope, resilience, and a commitment to living our lives to the fullest. Disclaimer for MD Talk, Health and Fitness. Welcome to MD Talk, Health and Fitness, a YouTube channel operated by Your MD Online LLC in collaboration with United Medical Group. Our content, including the various playlists such as Medi Nurse Essentials, India Fit, Yoga Sense, Health AI, Fit Revolution, Skin Saver Central, and others, is designed to provide educational and informative healthcare information. Please note the following important points. 1. Educational purpose. Only the information provided on this channel and in our videos is for educational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. 2. No doctor-patient relationship. The use of our content, including interactions in the comments section, does not create a doctor-patient relationship between you and any of the medical professionals or experts featured here. 3. Accuracy and currency of information. While we strive to present up-to-date information, we cannot guarantee that all the content reflects the most current research or medical guidelines. Please consult a medical professional for the most current advice. 4. Diverse opinions. Health and fitness topics can be subject to different interpretations. Our channel may present multiple viewpoints which do not necessarily represent the official policy or position of Your MD Online LLC or United Medical Group. 5. Liability. Your MD Online LLC United Medical Group and all associated persons or entities involved in the production of this channel shall not be held liable for any direct or indirect harm resulting from the use or interpretation of the content. 6. Third-party links. Our channel may include links to third-party websites. We are not responsible for the contents or reliability of these websites and do not necessarily endorse the views expressed within them. By using our channel, you acknowledge and agree to these terms.